When it comes to diagnosing iron deficiency anemia, the first thing that we do is take a proper medical history and a physical examination. So we take a very detailed history depending on the extent of the anemic symptoms, the duration, the frequency, and so forth. We check on their diet pattern. We check on the patient's gastric symptoms, and if it's a female, we'll go into the menstrual history and so forth. After that, we have got a detailed clinical history. The next thing that we do is we do a physical examination. So clinically, we try to confirm that the patient is looking pale, and we also look for any signs and symptoms that can suggest the etiology of the iron deficiency anemia. Once we have done that, then we go on to do the investigations. We do a full blood count where we actually demonstrate the low hemoglobin, and we look at the subset. We look at the MCV and MCH to look at the type of anemia that the patient has, whether the patient has got a microcytic hyperchromic anemia or a macrocytic hyperchromic anemia. Once we have established that, then we go into more specific investigations. We look at the iron studies. Here we look at three important parameters. Number one, we look at the serum iron levels. Number two, we look at the transferrin saturation. And number three, we look at the ferritin levels. So the iron levels basically tell us the day-to-day use of iron, the quantity of iron that we require for day-to-day use. However, the transferrin saturation and the ferritin basically tells us the iron store in the body. When we diagnose someone with iron deficiency anemia, we need to look at all three parameters. Once we have diagnosed the patient as iron deficiency anemia, whether it's an absolute iron deficiency anemia versus a functional iron deficiency anemia, next and most important thing that we do is to look for the etiology or the cause of the iron deficiency anemia. So here what we do is, depending on what we find in the history and also the physical examination, if patient complains of gastric symptoms or a bleeding hemorrhoids, patient can then be referred for a upper and lower scope, basically what we call as an OGDS and a colonoscopy. And if patient complains of having heavy menstruation, then we refer the patient to a gynecologist, where they will actually go through the patient's menstrual history and see what they can offer the patient depending on what is the structural problem. And then depending on the other various factors, we will then proceed with necessary investigations. The diagnosis of someone being iron deficiency anemia is quick. Just a simple blood test, full blood count, and iron study can be done in 2 days. However, we do not stop there. We proceed to investigate further. It's very important to establish the cause or the etiology of the iron deficiency anemia. Only then we can treat the disease as a whole, or complete recovery can be established.